pop out of nowhere. This should dramatically alter anyone's opinion of how serious this is.
There are now more than 28,000 confirmed cases of the new coronavirus worldwide. 25 countries are affected, including Belgium for the first time, and at least 565 people are dead.
In the meantime, there is little Ottawa can do for the 251 Canadians on board.
We will look at the cruise line in this case to repatriate those Canadians when the quarantine, which has been decided by local health authority, is finished.
A similar situation in Hong Kong, where 30 passengers on this ship have a fever. All 1,800 are being tested.
It's a scary headline to see, but the fact that this is two people that were in close contact, the sort of situation where you might, sort of assume would be the most likely kind of transmission to happen, that's pretty reassuring. It's not like we're seeing, but we are getting the sense that is something that happens with some frequency. This can be transmitted via droplets. The question is how easily that happens. That's still open, whether it can happen when people aren't showing symptoms. The biggest shift, the biggest consequence is that the WHO will get more power to sort of collectively direct government responses, to have a more standardized response, to demand, data in a certain format. At the end of the day, if they do end up declaring that, I would caution people to not take that as a sign to panic or something. It's just acknowledging that there's been enough of a spread, there's been person-to-person transmission in enough countries that it's worth coordinating a global response more directly by this organization that does have a lot of experience with these sort of global epidemics before.
In a sector that sometimes has to deal with virus outbreaks, one travel expert says communication is key.
At the time being, I think we cannot conclude the likely time of finishing the quarantine measures right now.
Anyone coming in from China who developed symptoms was urged to self-isolate and call NHS 111. They've now extended that guidance to anyone coming in from some other Asian countries, including Japan, Malaysia and Singapore. So
this is what happens when fear takes hold. Shops in Hong Kong today were being cleared. Rice and toilet paper, as rumours swirled of a complete shutdown of the border with mainland China.
Newly arrived American evacuees from Wuhan are now showing signs of sickness. They landed in California Wednesday and are now in isolation. Nearly 350 others are under a public health quarantine, the CDC's first in 50 years.
If there are people, walking around shedding virus right now that don't know that they have it, and potentially leading to, a greater spread in countries outside of China. So far, it's been pretty confined in just about every country outside of China, and I think that's why you have the WHO only now trying to make that determination once again, whether it's a global emergency or again just something that's of most concern in China.
There is some good news. These are patients who have recovered leaving hospital. But at the same time, from Wuhan, pictures the like of which we haven't seen in generations. Stadiums, gymnasiums and conference centres all being turned into fever centres. So desperate is the shortage of beds for the sick.
In Wuhan, ground zero for the outbreak, authorities sprayed the streets with disinfectant and turned a convention center into a makeshift hospital that...
It's really providing your customers with the facts of, this is what we're doing, this is what we have as a precaution. If you do have to take a drastic measure, informing your customer about what you're doing. People want to be aware, they want to be informed.
Something people on this ship may appreciate. It's been denied permission to dock in the Philippines, but has no confirmed cases. One Canadian passenger tweeted, "Not sure how or when, but it will be good to get home."
With no signs of the outbreak slowing down, China has enforced lockdowns and similar measures in 14 more provinces and cities outside of Hubei province. The cities affected include Hangzhou, Liaoning, and Nanjing.
The patient being treated here at a specialist unit inside St. Thomas's Hospital in London. It's no surprise the virus is fast spreading and more cases here in the UK were expected. But this time there is a significant development.
The fact that this is not so severe might be a potential avenue for further transmission. So on one hand, you're sort of reassured by the fact that the death rate isn't that high, but the fact that it isn't so serious means that it could go pretty far without people actually noticing too much, which is a little scary.
Medical Officer for England Chris Whitty, working with the UK's other chief medical officers, says this remains a serious problem for China, but there are still relatively few cases beyond that. If that remains the case, they say the NHS can cope with what's thrown at them. If the WHO change their guidance and it becomes a global pandemic, that could create serious pressure for the NHS.
It is our hope that the governments of all countries, including the UK, should understand and support China's efforts, respect the professional advice of WHO.
China is sharing more information than it did during the deadly 2003 SARS outbreak. But it's not officially confirming the death of Dr. Li Wenliang, who was one of the first to warn of the dangers of this outbreak at the end of December. He was silenced by authorities and forced to return to work, where he caught the virus from a patient. His death adding to the number of fatalities rising daily.
We don't know the source of the outbreak. We don't know what its natural reservoir is, and we don't properly understand its transmissibility or severity. To defeat this outbreak, we need answers to all those questions.
We are learning more about the virus, but much remains unknown. Pictures like this of medics in hazmat suits taking away a patient suspected of having coronavirus in York will do little to ease nerves in the city and elsewhere. The patient later tested negative. But the government is stressing once again that its plans are robust and the country is fully prepared to deal with this epidemic.
So you do hear sort of both sides. You saw the WHO press conference the other day. They sort of lavished praise on China for how rapidly they sequence the virus, how rapidly they're sharing information and the information they're sharing on a daily basis. On the other hand, you have reports that early on in the process, China perhaps hoped that it could sort of limit the sort of information that got out, maybe try to take care of this early without creating sort of the global media firestorm that we're seeing now. It does seem to be a mixed bag, but the first kind of authority I trust is probably the WHO, and they seem to be indicating that, especially relative to the SARS outbreak, other outbreaks in the past, the level of transparency and information does seem to be pretty good from China.